Virginia Mason is moving forward with a plan to merge with Catholic health provider CHI Franciscan. But some are worried that this could mean less access to medical care, including birth control and death with dignity. KARA 7's Alison Grande joins us live right now. And Alison, they're also worried about how it will impact the LGBTQ community.
Monique, CHI Franciscan is a Catholic nonprofit healthcare system, and so they are ruled by religious and ethical directives. So Virginia Mason says if that merger does go through, they will stop some services.
I think it's frankly awful, right? We're dealing with a pandemic right now. The last thing we need is further restrictions on healthcare.
Virginia Mason's planned merger with CHI Franciscan has local civil rights and healthcare advocates speaking out.
Our laws are only our laws if you have access points to access the services. So grave concerns about what that means for equity of access to care across the state.
CHI Franciscan is a Catholic nonprofit health system bound by ethical and religious directives. When merged with Virginia Mason, together they would have 12 hospitals and more than 250 sites of care. NARAL Pro-Choice Washington worries it will not provide all care.
Of course, faith-based hospitals that are pro-life. The biggest concern with these hospital mergers is that there are huge limitations to access to abortion.
The ACLU is concerned it will not treat all people.
Another concern we just have is what happens when someone who is LGBTQ walks in and asks for care and they're told to go elsewhere. Along with the not obtaining the service, what does that actually do to them and how does that make them feel?
And end-of-life services could end.
And if we lose Virginia Mason as a provider, we expect that it's harder to access death with dignity services that can lead to more violent and painful deaths and suffering that no one wants for themselves or for those that they love.
Virginia Mason told us the combined organization would benefit patients and transform healthcare through a better patient experience, more accessible healthcare, and better value. They acknowledge with a merger, some services related to reproductive health and physician-assisted death could no longer be provided at Virginia Mason facilities.
This is not what we need right now. We need hospitals and health systems stepping up and providing more care, not less.
Now, Virginia Mason says if that merger does go through and a patient needs a service that hospital does not provide, then their doctor will refer them to another provider. These healthcare advocates say the biggest impact with all of this will be in rural communities where there aren't as many options for healthcare. Alison Grande, KARA 7 News.